So I want to start by a big thank you to this lovely lady. Everybody's shy, but fortunately she's not, so it's really helpful. And I want to demonstrate what do we do after a facelift at home, starting like 1 week afterwards with the massage. Initially, it's like swelling from surgery, you use ice. But 3 days, 4 days after that, you don't need to. Then you have to switch over to using warm compresses or heat and lymphatic drainage massage. Really important, helps a lot, and I'm going to demonstrate that. So first of all, I'm going to get the nice lady here comfortable. And oh, by the way, she's looking great. So there you go. So we'll put her down a little bit. So you can do this at home. You can even have your spouse do it for you if you're on good terms. So the very first thing you need to know is that the lymph nodes from this area, they go right around here. From here they go all the way over here, and then from here they go backwards. From underneath, same thing, they go right here backwards. So all this drains here, this drains here and back. So this is the pathway, but finally it goes down this way. And the biggest area where the lymphatic drainage system exists is right around here, called the thoracic duct. That's where we want to get it. So also for the massage, you don't want to start doing it without heating first. So for the heating, we give you some packs. That's for icing, but also then afterwards you can put them in the microwave. So you can apply the heat packs yourself and hold it in hand, but it gets to be a little hard. You have to keep them there for about 10 to 20 minutes. So it's easier if you use the dressing that we give you, that one, and just shove them in there. I'll demonstrate, or with the other wrap as well. So let's start with this wrap first, because usually that's what you have for the first day. Okay, so we're going to place this right here. It comes all the way. So let's change the direction. Hugging all of the surgical area, and it's Velcro, so you can make it tight or loose. I made it a little loose right now because we have to get these packs in there. With the packs, there's always those beads and stuff. That's the hot side. Don't use it. This is what you want. This is very safe. This side. Always check on your hand before you do it, and heat it up slowly in the microwave. 30 seconds max. Maybe do 20 seconds, check it, then another 10, then another 10. Don't burn yourself, please. Once you're done, then you can put it right, because the neck needs it as well. So you can go right in here and put it in there, right there. Now you get another one for the side, right here, and another one. Remember, white side against the skin. Done, right there. And then you can leave this for about 10 minutes. After 10 minutes, you should be pretty good. If you end up leaving longer than that, no big deal. Now that heat is completed, you're going to take it off. So we'll just gently take it off and remove everything. Next, we're going to start with the massage. So I'm using arnica cream that helps a lot. But what I've found is that any moisturizer like Aveeno or CeraVe, Cetaphil, anything that you usually use, not anything new, so nothing new. Some moisturizer that you've been using, so you don't get an allergic reaction, you can use that. Flows much better. So this is for demonstration purposes today. So I'm going to first start. It really is a pampering as well, honestly. So you can do it yourself, but if you can have someone else do it, that's even better. So we're starting here right there, and right there. So we are going to move backward. We're trying to get the lymphatic flow out. If you also had the lower eyelid blepharoplasty, this is perfect. This is going to move all this stuff to the sides. So you keep doing that, and you spend time for the whole face massage. You should spend about 20 minutes. But I'm going to expedite it for sake of showing you. So once I've done this right here, moving it back, then I'm going to go down here with some more. And you can use a lot. I like to use a lot actually. So you don't want the skin to be rough. So now I'm massaging it here, just mobilizing. This is the area that has a lot of swelling. While you're doing this, you can get close to the incision lines as well. Remember, you can do some circular motion, that's good, but then also almost like squeezing it out this way, squeezing it out this way. And you can do it on the incision lines as well. Just be gentle in the first week you're doing this. Once you've done this for a while, also on the scars, make sure. Then you go on and sometimes you can do earlobe massage as well, because they become very swollen. So you can do it gently and massage them for a little bit. Finally, you get to the back. At this point, you can turn the head. It makes it a little easier to get to the back portion. And then you massage it right here. So you're massaging this back area massaging it and using the incisions and everything. Spend maybe like 5 minutes over here. Then it's finally, you know, you feel like, okay, you've done it. Now you're going to drain, all has been drained from here to here, here to here, here to here, and here. Now we'll do the final step towards where the lymphatic drainage system flows. It flows this way, right here. So we are going to massage it this way. There you go, more moisturizer. So now we have some more, as much as you want to use. So we're going here and moving it to the neck, right there. This is your sternocleidomastoid muscle. You can just follow the front of it. That's where it's hidden, right there. And once we've done this for a few minutes, then we can go to the other side and we'll do the same thing. First we'll do the back right here. And let's say we did it for like 5 minutes, and then we'll proceed to right along the muscle. Right along the muscle, right there. Gently, because the thoracic duct is inside deep down here, and that's where the whole area drains eventually. So we are doing this, got you. Now, this is a lymphatic drainage, but if you feel any cords in that area, because sometimes there's cords and stuff and you feel and you're like, what is that lump or bump? Then spend extra time doing a circular massage. And again, no dry massage, use more moisturizer, and you just kind of like tenderizing that area. You're just like breaking up all the scar tissue, making it nice and smooth. That's very important. You can spend as much time as you want, and sometimes I even use pressure right here, and I feel like if you keep it there for a little while, it squeezes out all the interstitial fluid, which is the swelling, up this way. Anywhere you feel like you got some strands, massage extra for as long as you want. And that's the bottom line. In the first month, I think it's good to do it twice a day. And twice a day, it's going to be 10 minutes of heating, 20 minutes of massage, and then also very important to keep the wrap on. And there are multiple different kinds of wraps. You can get one from Amazon as well, which has a better, texture, doesn't bother you as much. And make sure if you get from Amazon that you get the large size. I've tried all the different brands, and medium size is not good enough. You don't want to choke. But there's so many different varieties. They're very nice as well. So this is where, if you're going underneath right there, we put this on, and then this is supposed to get the ears out right here, but you don't necessarily have to do that. If you feel that's annoying, you can leave it like it is. And then I'm going to have you lift up your head, please, so I can do this back portion here. It's honestly trickier than it looks. It's just a pain in the neck. So, and now it's medium size, very tight. I don't want to torture the patient, so right there. If you have a large size, then it's not as bad. And then the last portion here. Some of these will have only one actually Velcro wrap. Make sure you don't get your hair stuck in there, because it can literally rip it off sometimes. So this is just for demonstration purposes right there and done. So if you look from front, it is more snug. Depending on the brand you get, it can be more snug, more comfortable. So try to get some really nice brand that is comfy. And we'll try to guide you as well. And this is what you keep on as much as you can for the first month. If you're home not doing anything, keep it on. And if you're unable to do so, then at least when you get back home from work, put it on and keep it all through the night. That's going to be very helpful. I hope it helps. Any questions, you can always call us, email us, text us, whatever you want. And also, again, please say thank you to her. Yes? Very good. Great. Click the link below to get a free consultation.